And good morning, I'm Dr. Deuk. We are broadcasting live on March 23rd, 2023, 3/23/23. It's a special day. We're broadcasting surgery live from the Deuk Spine Institute, and our patient here travels from Hawaii to the Deuk Spine Institute. Lay still for me. He's had back pain for, we say greater than 9 months, but it's been for 7 years on and off and really bad over the last 9 months. His back pain is in this area, his lower back around L4-5, L5-S1. We're going to get started, okay? If you feel any discomfort, let me know and I'll just give you some more pain medicine. So, like a lot of people, he's lived with the back pain not knowing that it can be cured. It can be cured now. Let's go ahead and inject some. And the procedure that cures back pain from a herniated disc or disc problem is the Deuk laser disc repair. The Deuk laser disc repair is an endoscopic surgery, and we are doing what's called an annular debridement. The reason why the surgery works to cure back pain is simply because we're targeting the actual source of back pain, which is the annular tear in the back of the disc. There is no other surgery in the world that does the same. All right, so we're going to be targeting L5-S1. You can see the L5-S1 at the bottom of the spine. That's the L5-S1 disc. Go ahead and show us, Jordan. Show us the L5 vertebral body.
Keep your head still, my friend.
Lay still. We can't have you moving around.
Keep still.
And then show us the S1. Very good. So that's the sacrum, or S. And show us the L5-S1 disc. And show us the back of the disc, right where the pain comes from. That's the exact spot where the arrow is. That's what we're targeting. All right? The nice thing about this particular type of surgery is that there's no bone cutting. There's no hospital stay. There's no complications to date from this surgery. And the surgery is done through a 7mm incision shot. 7mm incision is a 1/4 inch incision. You're going to see it's very small. Yeah, just lay still. Shot. All right. Of course, our patient is awake for the beginning of the surgery as we navigate down to the bad disc where he's having all of his pain. We need him awake so that he can help me. And the help that he's going to be giving me is he's going to report to me if I'm getting too close to his nerves. Remember, the nerve roots are in this exact area. Shot. Lay still. You're doing great. Let's get an AP view. We're going to use a combination of front, back, and side-to-side x-rays. We call it AP lateral. That looks really good. The L5-S1 disc, the one we're targeting first, is one of the most common discs to be causing back pain from a herniation there. This most common is L4-5. We're pulling data now to do a manuscript on the incidence of these different discs that cause pain. All right, so I'm right here at the herniation. I'm going to change the orientation of my needle. Lay still. You're doing great. Lay still. So we're in the first bad disc. Now, 5-1 is the hardest to get to of all the discs in the lower back. It's not as hard to get to as fixing a disc in the neck or the thoracic. Where are you numbing there? You got to numb here. So we're not using epi anymore, right? All right. We've numbed up the skin so we can make our incision. Once I place the L5-S1 needle, I want to make my skin incision. It's a 7mm incision. The entire surgery will be done through this one little cut. There's basically no bleeding. You could see maybe a few drops of blood and that's it. But compared to open back surgery where you're bleeding continuously throughout the whole surgery, This is just a few drops, and that's it. All right, you see we're off on orbit. You see the two bunny ears?
Yes, we do.
All right, I think that made it worse. Let's go the other way. So orbit means this orientation. That's better. All right, there's still a little bit of bunny ears of the L5 superior facet, but this patient has also what's called congenital spinal stenosis. Show us the congenital stenosis. Show us the pedicle of L5. See how short it is? So the pedicle of L5 starts at the back of the vertebral body. Show us the back of the vertebral body, up and down there. Yeah, right there. And then it goes back to the facet. Show us the facet right there. See that distance? Show us that distance. There to there. Very short. Should be much longer. Show us a more normal one higher up. Yeah, right there. So go down a little bit. Show us the inferior pedicle. There you go. So go there to the facet. Yep, there. Look how much bigger that is. That's about 5 times longer. That's a more normal pedicle. But his L5 pedicle is short, which means his neuroforamen is narrow, and that's from birth. And about 20% of the population has congenitally narrow neuroforamen. That's where the nerves exit. So they are predisposed to having nerve problems, like pinched nerve problems, leg pain, weakness, numbness. All right. Doesn't mean they're going to have it from birth. It means they're going to have it later in life if they have injuries to their spine, like this patient did. Shot? Now, what causes herniated discs? What causes herniated discs is trauma. I get it. Trauma to your spine. And how do you get trauma? AP? Sports injuries, car accidents, falling, jumping off your roof with your skateboard or surfboard into your pool. I mean, the list goes on and on. Falling off a horse. There's literally thousands of ways to traumatize your spine. But all disc herniations, all of them, 100% come from trauma. You may not remember the trauma, but it happened sometime in your life, usually when you're younger. Some people do remember the trauma. By the time I see people with disc injuries and I fix them, they've had trauma for about 20 years from their spine. So 20 years ago was a trauma. Shot? That's the average, probably. Are you comfortable? Big tear there. That went in easy. Are you comfy? So we're going to show you a video in a moment explaining how does a herniated disc actually cause back pain. Okay, but for now, I'm going to tell you when I met this patient, it was through our Deuk Spine Institute virtual consult. Deuk Spine Institute virtual consult. He lives in Hawaii. We are in Florida. And he watched our videos and saw the results of the surgery and realized this was the best surgery available in the world for somebody with back pain. And he decided to come here and have his surgery done. When I asked him, where is your back pain? He showed me his back pain's right in this area here. Okay. Well, what's in this area? You have two discs. You have the L4-5 and the L5-S1. And when I looked at his MRI, I saw that he had tears in both discs in the back. We call them annular tear, and he had a herniated disc as well. Then when I actually examined him as well, he said, well, I get a lot of pain off to the side here. And what's over here is your facet joints. So he has two facet joints, the L4-5 and the L5-S1 facet joints that are also causing pain. So we're going to be treating his facet joint pain with the Deuk plasma rhizotomy. We call it the DPR. We're going to be treating his disc pain with the Deuk laser disc repair. All right, are you awake? You ready to get started?
He said yeah.
He's like, I thought we already did start. Anyway, are you comfortable?
How you doing, my friend? You said yes.
All right. How bad is that on a scale of 1 to 10?
Give us a number.
8. Is that
What's the highest it goes? What's the highest it goes?
8?
8. Is that where you typically get your back pain?
Yes.
8 over 10. Good job. All right. You feeling better now?
Are you feeling better? He said he can't really tell.
Is the pain still there, guide wire?
He feels like a champ.
Oh, like a champ. Is the pain still there or is it gone?
Is the pain there or gone? It's gone.
All right, it's gone. So what I did was I did a discogram. Can you show? Oh, you're killing me. Well, you saw, did you guys see earlier, Henry, a dark area in the
Yes.
disc?
Yes, we
All
did.
right, so
We saw
there's
that.
a tear, and that's where his pain's coming from. You feeling better? All right. How bad is that on a scale of 1 to 10? All right. Is that where you get pain typically?
Yes, it is.
All right, very good. We're going to put you to sleep. I need you to count from 1 to 100 in Hawaiian. All right?
He said, no.
All right, we're just having fun. So at this point, the first thing we're fixing is his 2 bad discs that are causing back pain. Then we're going to fix his facet joints afterwards, later on, once we're done with the 2 discs. But to verify that my diagnosis was correct, that the discs, you need to count out loud from 1 to 100 out loud. Keep going. 1, 2, keep counting. To verify that the discs, keep going, are indeed the cause of his pain, I did a discogram, all right? Which is a test where I put some dye and pressure inside those 2 painful discs, which I believe were painful, and he confirmed that they are. And as a matter of fact, those 2 discs are causing his daily pain that he gets every day. So we know we're going to fix that pain now because we're going to be fixing those 2 discs. Keep counting. You got to keep counting. You can't stop. Shot. If you stop, then we're going to assume you're asleep and we're going to start operating on you. You don't want that. You want to be asleep for that. Keep counting. All right. So he's stopped. Shot. Come on. Jordan, you see my hand moving. You need to be taking shots so I can see where I'm at. Okay? Especially if I'm looking up there. It's automatic. Great. So we're starting with L4-S1. We've just placed the guide wire and now the dilator. The dilator has a tapered tip. It looks like a pencil. Jordan? Go ahead. There's the tip. Now, I'm at the herniation at L4-S1 right now. All right? So we're just underneath the nerve root that's exiting the L5. And you can see the tip of the guide wire at the front of the disc. I'm going to pull that back a little bit. Shot. And now I'm going to advance this dilator over the guide wire. I know the guide wire creates a safe path to the herniation. Perfect. So now we're getting inside the disc. Excellent. Now because I knew from my AP X-ray that I was a little bit lateral in the disc on the left side, I aimed my dilator more towards the midline as I was hammering it in so that I could get more medial. In the end, our goal is to be in the posterolateral tear, which is the tear in the back corner of the disc. That's where the herniation is. Nobody likes watching me hammer, but I can tell you, compared to the other things we do in neurosurgery, with you guys not seeing them, this hammering is mild. You should see when we start drilling things, like when we take a skull cap off, or we take somebody's skull off to work on their brain. That I'll show you someday. I'll do some outpatient brain surgery and video it for you. But that's 1,000 times more barbaric than what you're seeing here. The public has no clue what we do. That'll be under local. So, but those are small little holes in the skull. I'm talking about a true flap, like a trauma flap, you know. So the point is that the hammering is nothing compared to what some of the other things we really do that you all don't see. Anyway, you can see the entire surgery is going to be done through a small tube. It's called an endoscopic portal or a tubular retractor. There's different names. We are now inside the L4-S1 disc. You can see some of the grunginess here, some of the bone spur, some of the disc herniation. We're going to pull it out.
Blue towel, please.
We're using a grabber.
Thank you.
We call it a pituitary rongeur. For abbreviation, we call it a grabber because that's what it does. It grabs. It's not a bad idea. We've got animations though. Better than that. We've got animations. I'm working with a team of animators now around the world to make animations for our new website. You should see them. They're incredible. I've been designing them with the animators for a few months now. All right. The blue stuff is herniated disc. The white stuff is annular tear. And the blue is degenerated herniated disc. There's a piece of herniation right there. Now, for those of you who haven't seen this surgery before, the laser fiber is right there at 12 o'clock. It looks like a piece of glass, like a glass rod. That delivers the energy from the laser machine, which is at the patient's feet. It's a large machine. It looks like a briefcase, or a large suitcase. That laser fiber, for your reference, is 1 millimeter wide. So the inside of the tube, going from side to side, is around 5 millimeters. The outer diameter of the tube is 7 millimeters. We're talking about a very small space, but it looks big. There's a piece of herniation. Okay. Whoops, it fell off. There it is. Oh, did you hear the sucking as it was coming out? All right, there we go. It's like a plunger. All right. All right, let's show our audience, Henry, why do herniated disc, degenerated disc, bulging disc, ruptured disc, protruded disc, extruded disc, slip disc, why do they cause back pain?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Yeah, thank you. Welcome back. Now you've seen our video. It shows you why people get back pain or neck pain from a herniated disc. It's actually due to inflammation that happens within the tear. And unfortunately, you're not going to be told this by anyone else because other doctors don't know. And there it is right there, the inflammation. Can you get a picture of that? Right there.
Yes,
Let me
we
see
can.
if I can clean it up. Take a couple of pictures because this will go again in our file. You can see the pink tissue. The pink tissue is the inflammation tissue. It's like a zit on your face. It's pink and red. It's due to blood flow. All right. So once I zap that with the laser, the pain goes away because all the little nerve fibers in there. All right, let's include that one in our compilation video.
Copy
right?
that.
I mean, we got some good ones, but that's a pretty good one too.
Copy
We
that.
don't always see that much inflammatory tissue in one spot. Usually it's spread out throughout the tear. You see little pockets of it here and there visually. But remember, that little nidus, we call it a nidus, N-I-D-U-S, that nidus of inflammatory tissue within the annular tear, that is a source of back pain. That was discovered at Deuk Spine Institute by me. And we know that that nidus is the cause of the pain. We're going to zap it away. Still a little bit left. That is around, what you just saw is around 2 millimeters wide. That's tiny. That tiny little thing is causing so much pain. And in so many millions of people. And unfortunately, you won't hear this anywhere else because we're the ones who discovered that at Deuk Spine. Now there was an anatomist, a Swedish anatomist. I believe he was Swedish. I don't know the spelling. Rorschach or something like that. I can't remember. It's been years. But he used to look at cadavers of people who had back pain. And he identified this inflammatory tissue right there. You see it again within the disc, right? And that's where I discovered this whole concept of inflammation in the disc and putting it together that it's a cause of pain. Well, that's what we did. And by treating it with the laser, that area of inflammation, and getting rid of the back pain. There have been other doctors before me, surgeons, that have suspected that the disc is the source of back pain. For example, even the greatest of surgeons, like Cloward, many years ago, he did some tests on patients with back pain. He went in their back, opened up the lamina, looked at the disc, and then started poking on it with a metal instrument. And he published that results, and he said by poking on the disc of these patients, certain discs, that he could elicit back pain with them awake, by the way. That was back in the 60s, I think. But everyone's ignored those studies, and nobody's really paid attention to them. But those studies were the foundation of my thoughts and beliefs that we could actually identify the source of back pain to a 2 millimeter spot, like we just did. Now the rest of this is annular inflammation tissue, scar tissue. This is called interposed nucleus, which is basically the herniated nucleus stuck within the annular tear. Everyone in spine surgery today and for the last 50 years has focused on the herniation that sticks out the back. We call it the mushroom cap. But the real problem is not as much the herniation sticking out the back as it is the part that's stuck in the wall, causing the inflammation. This is called the Deuk laser disc repair surgery, for those of you who don't know. I'm just about done here at L4-S1. This patient's back pain will be gone for the rest of his life as long as he doesn't re-injure his back. He lives in Hawaii and Maui, and he likes to be active. He's young, he's fit. He's basically had his life robbed, the quality of life robbed from him because of his back injury, these 2 bad discs, okay? So he wants to get back to being active, biking, swimming, surfing. And of course he can, but we've got to let this heal. And I tell everybody it takes 9 months to completely heal. Now it could take shorter. I tell everyone to wait 12 months because that's the safe bet, is to wait 12 months. Why does it take so long to heal? The reason why is because the disc is avascular. It doesn't have a blood supply except for the outer part. It's called the outer annulus, outer half of the annulus. So all the healing has to come from blood supply. Your body cannot heal a tissue if it doesn't have a blood supply to the tissue. All right? So without blood supply, there is no healing. And the blood supply comes in the form of capillaries, arterioles, and venules, small little blood vessels that take blood to that tissue. What does blood have in it? It has glucose. It has nutrients. It has vitamins and minerals. It has oxygen. And it also takes away cellular debris, metabolic debris, which is the byproducts of metabolism, okay? What is metabolism? Well, life. Life is metabolism. Metabolism is processes that go on at a cellular level or at a tissue level that basically require energy and oxygen in an aerobic organism like humans, and we produce metabolic waste as a result. Like carbon dioxide is probably the most famous metabolic waste that cells produce, and so that waste has to be taken away. There's a piece of herniation. And what takes it away is the blood supply. So when you have an injury, like a disc that's been repaired or whatever, and, you know, some kind of injury to your body, that tissue, skin, muscle, whatever it is that has to heal, liver, kidney, you name it, has to heal. It needs oxygen. It needs glucose. It needs to have carbon dioxide and other metabolic waste products removed. And to do that, you need a blood supply. There is another process that provides nutrients for healing to tissues and removes waste, and that is called diffusion. Diffusion was the original mechanism that organisms, living organisms, used to transport nutrients from one place to another within that organism. And diffusion relies on concentration gradients, and it relies on pressure gradients. So, and electrical gradients. So it relies on gradients, basically gradients. Whether it's a concentration gradient, a pressure gradient, or an electrical gradient, that's how diffusion occurs. So the movement of substances in the body can occur by diffusion, which is extremely slow. It's an old way of transporting things. And it occurs by concentration gradients, or electrochemical gradients, or pressure gradients, okay? Then you have active transport, which involves the use of some energy to use proteins that pump or move things around. And then you've got the vascular system, which is the most sophisticated way of moving nutrients around in a body, in an animal. And only higher organisms have a vascular system, okay, like humans. And that vascular system is what we're referring to as transporting nutrients to the disc. The disc, unfortunately, it's very old, I guess, and it uses mostly diffusion, which is the oldest form of transportation of nutrients. So, very interesting stuff. If you look at the evolution of tissues and organisms and study the processes that were involved in that evolution and how they manifest themselves in the modern day, you can understand things a little bit better as to why they occur the way they do. But discs take a long time to heal. Let me have the grabber. We're almost done here. All right, let's show the video to our audience on how does this Deuk laser disc repair surgery help people with a herniated disc that have back pain.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, welcome back. I understand you've watched the video now and you understand how the Deuk laser disc repair surgery actually works. To remove the herniation that shouldn't be there, that's stuck in the tear, the annular tear, that's causing the inflammation within the annular tear. So your body's inflammatory system reacts to the interposed nucleus stuck in the annular tear that shouldn't be there by attacking it. And the way your body attacks things is There's two ways: your inflammatory system and your immune system. And of course your fingernails. If something's bothering you, you might scratch at it, but the actual systemic way your body attacks things is your inflammatory system. That's your body's army, and the immune system is like I don't know, it's like what's the more sophisticated branch of the military? I got to be more careful. I got to be careful how I say this. Let's just call it Space Force. Well, he's a Marine, right? So we'll call it the Marines, all right? Maybe the Marines have the best tech. So the immune system is a lot more sophisticated than the inflammatory system. The inflammatory system's been around for a long time, and the immune system has evolved more recently to deal with things like viruses and other types of microorganisms, okay, and self, non-self, foreign invaders of different types. But the inflammatory system is extremely old, and at least you got to be putting pressure, okay? That's your primary focus, not that.
Yes, sir.
That's my job, okay? As long as this isn't an issue, your focus is that.
Yes, sir.
All right, so let's take our question from our audience. I think it's a little more lateral, right there. Yep.
This question comes from SRT Junior 99 on YouTube. And they ask, since my herniation T4-5 is impinging on the thecal sac, I am curious as to what that means and if that is a normal situation.
Yeah, herniation impinging on your thecal sac is not normal. Herniation is not normal. There's nothing normal about it. It's totally abnormal. Shouldn't happen. And what it means is their herniation is pushing on your sac around your spinal cord. So the concern is that there's going to be damage to your spinal cord. At T4-5, that would make you a T4-5 paraplegic. So your arms would work fine, but your legs would never work again, and you wouldn't be able to control your bowel and bladder. So you would pee on yourself and poo on yourself the rest of your life if that gets worse. It's a serious problem. Sounds like you need to get it looked after by a neurosurgeon. All right. Very good. So we're entering the next disc, which is the L4-5, left approach. This is his second herniation. This has a bigger tear in the annulus than the L5-S1. I can feel it. It's huge. Shot? You got to be careful when you're putting the tube in. Show us the tip of the tube, Jordan. Yep, it looks like an oval. You got to be careful as you're putting the tube in. Sometimes a little disc material gets caught between the tube tip and the dilator, and it shoves the dilator forward. So you got to watch to make sure the dilator is not moving forward, but also the dilator can move backwards just like that with pressure from the disc. If the disc is really inflamed, it's swollen, it's going to put a lot of pressure on the dilator. Okay, the tube is in place for the second herniation. Let's go, let's get this fluoro out. Come on, Jordan. We're moving at a snail's pace today, guys. Let's pick it up. All right, any questions from the audience?
Yes, we have a question from
Hotel?
Marabi on Facebook.
Yes, Marabi.
And they ask, this is a great job. Many people need this procedure.
Yes.
Why are there just 1 to 5 likes?
1 to 5 likes?
Yeah, like people liking it on YouTube or Facebook. That's my assumption.
Marabi, I was hoping you could tell me. Right? That's the great question, isn't it? So you're talking about social media, and you're saying on social media it has 1 to 5 likes. What does that tell you about social media? The reason it has 1 to 5 likes is we don't promote it. We don't pay money When Facebook says you want to boost your post, we say no, we're not going to waste money on that. Okay, why? Because unless somebody wants to come in and pay for it, let's get them to pay for it. But I'm not going to pay for it. I'm the owner of the company. I have no interest in wasting my money on boosting posts on Facebook. And then on Instagram, it's the same thing. So basically, Marabi, what you're saying is true. The reason why there's so few likes is because so few people see it. So few people see it because you don't share it. So few people see it because the companies like Facebook, Instagram, TikTok, Twitter, YouTube, they all want me to pay them so that more people will see it. I'm not going to pay them money so more people will see it. I want you to promote the video. You, the viewer, you, the person who cares. Because I'm not the one with back pain. The owner of this company doesn't have back pain. The owner of this company doesn't need this surgery. You guys need this surgery. So you guys should be the one promoting it. After all, it's social media, isn't it? Social media is supposed to be about the audience sharing important good things. It's not supposed to be about the social media companies getting fat and rich off of charging people like me who come up with a great idea and I want to share it to the world. Why should I have to pay millions of dollars in costs to share it to the people who need to know about it? I won't. What I do is I produce these videos so people can learn the truth. By the way, that's the tear right there. Can you see that? Henry, let's get a good shot of that because this may be one that you want to include because we're already having it in the specials. You may want to have that tear right there included because that's a really good picture of the annulus on both sides of the tear and how the jelly is stuck inside the tear. Get a picture of that.
Got it.
And get a couple, obviously, because one of them may not be good. It may be blurry or something. But anyway, that's the tear that causes all the pain. The long story short, folks, is I produce these videos with my own money so that you all can learn about the procedure. But I'm not going to promote it. I'm not going to give these companies more money to market it, okay? That's your job. If you guys care enough, you market it to the people that need it. Don't ask me to create the surgery, make the video, and then pay out of my own pocket gazillions of dollars to pay Google and social media companies to market this technology. If you guys see the benefit of it, which you should, it's obvious to me, you guys should be the ones sharing it and promoting it for me and for other people. Not for me, but for the people who need it, okay? That's why there's so few likes, because I don't spend any money on promoting any of my media. I want you guys to promote it. Okay? That's simple. That's the answer. Straight from the horse's mouth. This is so special that it's so obvious that it's so special that people should obviously promote it themselves through grassroots, not requiring me to promote it. If you want to boost the post, you can. Send us some money and we'll boost it. And we'll get more likes. All right, so this disc, to be comparing it to the last one, is a lot healthier, in my opinion. This is a more recent injury at this disc. The L4-S1 looks like an older injury. It's more degenerated, further along in the degenerative process. Again, I'm happy to educate you guys and teach you with facts, but I'm not going to promote these videos to get more likes. I'm not after likes. I'm after helping people get better. That's what this whole production is all about. It's not about likes. I'm not a YouTuber. I'm not a YouTube influencer. I'm not trying to make money from YouTube by making videos and getting views and likes and whatever else those guys ask for. I just want people to see the truth, and if it's important enough to them, they'll share it with their friends and family and other people that are suffering so that they can get out of suffering. Okay, the reason I do these videos is just to educate people. It's not for any other reason. It's just so that people know that they have hope. There's so many people out there living lives that are miserable with back pain, and we can cure every single one of them. But they have to come here and get these procedures done. Okay, they can't get cured without it. This is the cure. But again, my feeling is that it's not my job to promote it. It's your guys' job to promote it. My job to make it. Your job to promote it. Maybe you don't agree with me, and I don't care. Because I'm not here to do what you want me to do. I'm here to do what's right. And what's right is to fix people and to let other people know that that's an opportunity for them as well. Okay? Like I said, I don't do this for popularity. I'm already popular enough with myself. You like that? I'm my own best fan. All right, that's pretty much it, guys. That disc was swollen, really swollen. You can see how swollen it is. It's like bulging out, you know. And then this is all the foraminal fat. So maybe just this is fat, by the way, for those of you who are interested. It's a little overexposed with the camera with the lighting, but the fat is in the foramen. It's around the nerve roots. The purpose of the fat is to provide energy for the nerves that are living inside this area. There is a nerve here, and at L4-5, that nerve is going to be the L4 nerve root. Let's see if I can show it to you. It's going to be up here, but it's buried in fat. You guys see the fat around the nerve? That thing to the left is the nerve. You can barely see the kind of the white below the fat, but the reason it's covered in fat is two reasons. Number one, fat provides protection, like a cushion. And number two, we're done. The fat provides energy for the nerve so it can function. It turns out that neural tissue is the highest metabolic tissue in the body. You know, if you look at different kinds of tissue, like muscle, skeletal muscle, cardiac muscle, smooth muscle, those are the three types of muscle. You've got nerves, neurons, right, basically. You have the support tissues, like collagen and, fibroblasts and macrophages, and you have the inflammatory system cells. But the most metabolically active, the ones that take the most energy, are the neurons. And neurons are what make up nerves. So that nerve right there that brings information, sensory information from the leg, is very active metabolically, and the cell bodies for that nerve live in that area right there called the dorsal root ganglion. And they need lots and lots of energy. Unlike the brain, peripheral nerve neurons can actually use fat. They can use ketone bodies, which are from fat, to provide energy for themselves, to live and survive and do their job. So you'll never find fat in the brain because the brain doesn't use fat for energy. It uses sugar, only sugar, glucose. There's so much people don't know, you know. And I enjoy teaching you guys. And I enjoy taking your questions. And I'm happy to do so. If you have any more, feel free to type them up. But we're going to move now from the Deuk laser disc repair, performed here at Deuk Spine Institute and basically near Orlando, Florida, but near SpaceX and NASA. And we're going to move to the Deuk plasma rhizotomy. So we're going from treating a disc problem to a facet joint problem in this patient. All right. So feel free to ask questions.
We have a couple questions.
All right, give me a second. I'm just going to start this and then I'll take the questions, okay? I
Copy
just
that.
need to focus right now for a moment. You think right here? There's the top X.
Yes, yeah, so that's one, yeah.
So probably here. All right, we're going to use the X-ray machine to navigate. Shot. All right, good. So you can see I'm a little bit too low. I need to be a little bit higher. Excuse me, a little bit higher. And once again, we're going for the source of facet joint pain, which is, show us the facet joint there at L3-4. That's the L3-4 facet joint. And just lateral is the transverse process. Show us the transverse process, right. And what we're aiming for is where the top of the transverse process meets the superior facet. Show us the superior facet of L4. Yep, show us it. It goes up. You see the point like a triangle right there? Show us the triangle. Yes, yes. Now, that lateral part of the triangle, show us the yes. Where that meets the transverse process. To the left a little bit, right there. No, left. There. That's where the pain nerve is for the facet joint. That is where we need to target. And the most common procedure in the world done for this is called an RFA, radiofrequency ablation. But Deuk Spine Institute developed a new technology that is better than an RFA because it lasts longer and it works better. Shot? That's exactly, well, we're a little bit lower than where we need to be, but right there. Shot? Let's see if that is. So that's perfect. See where the tip is, folks? That is the most perfect place you could possibly pick. That's where the pain nerve is. I'm going to target that. I'm going to go there, and I'm going to burn the heck out of that pain nerve so it never wants to come back again. By doing that, the patient will eliminate their facet joint pain. All right, we'll take some questions.
The first question comes from Canes25 on YouTube. And they asked, Doc, what is a bone spec scan and how helpful is it for diagnosis?
What is a bone spec scan and how helpful is it for diagnosis? So first of all, a bone spec scan is done for certain diagnoses, but definitely not anything to do with discs. Okay? So I don't know why your doctor would want a bone spec, but usually it's to diagnose things like tumors, infections, things like that, or fractures. Okay? Tumors, infection, fracture. So you have to ask your doctor why they would order a bone spec scan, because I don't normally order those because they're not helpful in diagnosing the back pain that's coming from a degenerated disc, for example. Okay? So we don't typically order those tests. We order them only when the patient has a suspected tumor or infection or fracture. So I just did the burn, and I'm going to move my tip around. I can actually feel the lateral part of the facet joint right there. I'm touching it, okay, with the tip. You guys see the tip? Show the lateral part of the facet there. Jordan, thank you. Lateral part of the facet. Yes. Show right where the tip is. Yes. And the tip is just touching, just below that, right there. I'm feeling the lateral wall of the facet. And I'm burning that whole area, and we're done. So that's how quick that is. Okay, it just takes literally a few seconds, and you're done. So now I'm going to, what? Awesome. Now let's move on to the next one. This is going to be the L5 transverse process, where it meets with the L5 superior facet. Yalla Habib. Yalla, take a picture. I want to see. You got to line up first. All right, so get all that lined up. You a little bit underexposed. What's the next question? All right, show us the transverse process of L5. This guy has really nice anatomy, folks. You guys get to see this. Try to darken it up so the audience can see it better. I can see it, but I want the audience to see it. All right, I guess that's okay. Maybe lighten it just a tiny bit. I think it's a little too dark. All right, show us where the top of the TP is. It's a bit thicker, yeah, and show us where it touches the superior facet. That's right there. Good job, Jordan. Jordan has become quite facile with anatomy of the spine and the lumbar region. All right, so here we go. I'm going to try to go through the same incision as I did last time. It doesn't always work. I may have to make a separate incision, but I'm going to try to use the same incision, and we'll see how close we can get. All right, it's a little bit too medial. I want to be more lateral. Shot? Oh, it's perfect. That's the exact spot we want to be. And I feel there's bone there, okay? The key is, as a surgeon, you have to feel the bone with the tip of your needle. Yep, it's perfect. That's exactly the spot we want. You guys see that?
Yes, we do.
Show us the tip. Show us the tip. Because it's kind of hard for people who don't know. That's the tip of the needle. Show us the back of the needle. That's the part that's here in the operating room. It's got a little head around it, made out of plastic. You can kind of faintly see it because it's got some radio tracer in it. All right, next question.
Next question comes from Kathy on YouTube. And they asked, if the disc is highly degenerated, is all the degenerated tissue, in parentheses, blue stain, removed from inside the NP space, or degenerated tissue from the annular tear?
That's a great question, Kathy. Thank you so much for asking. Give me 1 second to just get this where it needs to be, and I'll answer you. All right, that's going to be a longer answer, longer answer we need to address. But so again, a lot of people don't understand the nature of degenerative disc disease, and they think that they have all these ideas about how it should be, but the problem is they're getting all this misinformation from doctors who truly don't know what the hell they're doing. Okay? The fact of the matter is the disc has two parts. It has a nucleus and it has a annulus. I mean, people talk about the end plates, but I don't consider the end plates really part of the disc. Okay? The end plates are the bone from the vertebral body above and below. Show us our next target. Shot. Yep, that's our target, right where the white arrow is. Huh? This is it, yeah. We're almost done. We'll be done in 2 minutes, maybe 3 minutes. So the two parts of the disc, the two parts that really matter are the nucleus and the annulus. Shot? All right, that's pretty damn good right there. Let's go ahead. Knife. And all disc problems, all of them, come from the annular tear, the herniated nucleus, into the annular tear, or outside the annular tear. So it keeps going. And back pain, neck pain, thoracic pain all come from the part of the herniation stuck in the annular tear. Okay? Relax. We call it the interposed herniation, because it's interposed or stuck between. That's what interposed means. It means between. It means position. Pose is position. Inter is between. Interposed, position between the fibers of the annular tear. Okay? Shot. So there's the interposed herniation, and then there's the part that sticks out beyond the disc, which is what everybody refers to as a herniated disc. But it's not truly a herniated disc, because the interposed part is also herniated. So it's not just the part sticking out. If you think about a mushroom, the mushroom isn't just the cap, it's the stalk and the cap. And everybody ignores the stalk. The stalk, which is the part of the herniation stuck inside the annular tear, is where all the back pain comes from, and neck pain. And we discovered that here at Deuk Spine. The cap doesn't cause back pain, but the cap is all everybody cares about. That's all they see on the MRI. They don't get it. That's not important. The cap sometimes presses on nerves and causes radiculopathy or neurogenic claudication, nerve symptoms. The nerves down your leg, that is, not back pain nerves. Okay? So the actual back pain comes from the stalk. The leg weakness, numbness, tingling comes from the cap. So most people don't come to the doctor saying, I have leg weakness, numbness, tingling. It does happen, okay? But most people have back pain, and the back pain comes from the stalk.
Lights on, please.
Thanks, everybody. Great job. We're going to put some bandages on, and we're going to be done. And I want to talk to you when we're done. Great job, by the way. Nothing serious, nothing. We'll talk about the laser and something else. All right, great job, team. Questions? Type them up for me. I'm going to come and answer them for you in a few minutes. In the meantime, we're going to show you another video of one of our patients who recently had this Deuk laser disc repair, or the Deuk plasma rhizotomy. And then I'll come and answer your questions face to face. Okay, and we'll talk more about the degenerated disc. Hello, I'm Dr. Deuk at the Deuk Spine Institute, and I'm here with one of my patients who's just came in for a checkup today, and she had the Deuk plasma rhizotomy. This is a new type of rhizotomy being done to treat facet joint pain. I say it a lot, but the most common cause of back pain and neck pain is a herniated disc. The second most common cause is a arthritic facet joint that's painful. And the standard treatment these days is something called a radiofrequency ablation, or RFA rhizotomy. The problem is that RFA rhizotomies don't deliver very much energy to the facet joint. So if they get the nerve, usually it's temporary and the nerve just grows back. We figured out a way to deliver more energy through what's called a plasma rhizotomy. It's a Deuk plasma rhizotomy, and you had it done about a week ago. How do you feel today?
Amazing.
Yeah?
I have zero pain. So
And what did you say to me earlier? This is the first time you've been pain-free in
years.
years. How many years have you been dealing with back pain?
Yeah, probably 10.
10 years.
It's been a long time.
And
yes.
you look very happy.
I'm very happy.
Now,
very happy.
you did have the RFA. It worked for, gave you some relief for a little while, then the pain came back. And this feels different though.
This feels different, as in within 2 days I had zero pain.
It's awesome.
And now here I am a week later. I can run a marathon, I think.
Good.
I
Well,
mean,
we want
I
you
won't
to.
yet, but I can, so.
All right, and there's millions of people out there, and that's why we do these testimonials, really for them, not for me, not for you, but it's to spread the message of hope that there is a way to get out of back pain. You just have to stick with it, find the right place, get the right procedure, and eventually you can get there. And what do you say to that?
I say you're correct. That's Deuk Spine Institute didn't give up on me. I've had several procedures, but you kept pursuing my pain until you figured it out. So thank you very much.
You're welcome. My pleasure. Anything else you want to say to your fans out there?
To my fans, come see this man. He is amazing. Deuk Spine Institute staff is amazing. Everyone treats you with respect, and they listen to you. That's very important to me. So I just want to encourage people, don't live with the pain. Please come see Dr. Deuk and Dr. Patel at the Deuk Spine Institute.
I appreciate you saying that. The lesson here is don't give up on your pain.
Yes.
There is a way to fix it. And a lot of patients, probably about 25%, end up having more than one source of back pain. And we have to treat each source because each source requires a slightly different treatment. The rhizotomies definitely were what you needed, but you needed a rhizotomy that worked well because of all the inflammation of the facet joints and the scar tissue. And the plasma rhizotomy is the most powerful rhizotomy that can be done. It's only done at Deuk Spine Institute. So congratulations on your
Thank
new
you.
lease on
Thank
your
you.
back. All right, let's get you out of here. And good morning, I'm Dr. Deuk. I'm here with one of my lovely patients from Canada who's visited us because her back has been hurting for 7 years. She's had a herniated disc that she's been kind of monitoring at L4-S1. And finally, it really started bothering her a lot over the last 7 months to a year, causing pain down into her right leg. So she decided to do something about it, and she went to see her doctor in Canada, who then said, yeah, I'll have you see the specialist in 3.5 years. Well, that wasn't going to work for you, right?
No.
Yeah, because you don't want to live in pain for 3.5 more years. And even then, you don't know what you're going to be offered. But she found the Deuk Spine Institute and learned about the Deuk laser disc repair endoscopic surgery. And you had it done yesterday.
Yes, yeah.
How are you doing?
I'm feeling great today. I have no pain in my back. I have some tight muscles from me having to walk very oddly for quite a while due to the sciatic pain. I must say, this is the happiest I've been in a very long time to be able to stand up straight and go for a walk. Because I'm an active person as is. I ride horses for a living, so having to be locked up in my room for the past while has not been good. So this has felt amazing, amazing.
So you're happy with the results?
Very. I feel very hopeful also to be able to do what I want to for the rest of my life.
Yeah, after we let the disc heal, right?
Yes, full year of nothing, and then we can.
Yeah, I wouldn't say nothing, but you know, horseback riding, it's one of those things where I love horses and I love riding horses. I'm not very good at it, but I'm one of those people you see bouncing up and down, up in the saddle. So I know that it can be rough on your back, and I just want to make sure you give your back a full year to heal. So you can see in your surgery right here, we actually tested your L4-S1 disc with a discogram, which is a test done to verify that that disc is indeed causing your back pain. And when we tested it, you said, and we asked you how bad it was, you said 10 out of 10 pain. And I said, is that your typical pain you get every day? And you said, yes, it is. So we verified the source of your pain was the L4-S1, and you can see the laser was used to clean the tear endoscopically. Your incision was only a 1/4 inch, and there's no need for fusion or metal or artificial discs. This surgery replaces fusion and artificial discs. What are you going to do now that you're feeling better?
Well, it's, again, don't worry, I will take it easy, I promise. But no, I'm going to be, after this, this year, I hope to be the strongest I've ever been. And I have very high hopes and whatnot. My dream is to make actually the Canadian Olympic team for my sport. And that's end goal. And I feel like it's a possibility now.
Absolutely.
Do it.
You can.
Yeah.
We're rooting for you. And I know you have an incredibly supportive husband who's been by your side the whole time. He's a delightful young man, and I've had time to talk to him as well. So you're lucky you have support from your family to help you get through this.
Yeah.
Anything you want to say to your fans out there?
Oh, geez, I don't even know where to start other than just this place really can offer you really what either you deserve or what you need going forward to be able to live a happy and good life. And it's amazing to me that literally it was yesterday I woke up from it and I went for a short walk like immediately, and I felt amazing. So it's it's very hopeful. And if there's you are suffering from any of it, don't wait, especially for the Canadian system. Come and do this. It's worth it. It's really worth it.
Awesome. And I'm going to be, and my whole team is going to be watching the equestrian sports and the Olympics, looking to see for you to be there.
Yes.
All right.
Awesome.
And
Amazing.
of course, supporting you.
Thank you. Yeah.
All right. Congratulations.
Thank you so much. Thank you.
All right. Take care. And I'm Dr. R. Deuk here at the Deuk Spine Institute. I'm smiling because I'm sitting with my first surgical patient of 2023. I don't know if you realize that, but you were the first one of this year, of the new year. Now, you had the Deuk laser disc repair done on your lower back because you had 3 bad discs, and we did that yesterday.
Yesterday, yes.
And here you are, one day later. How do you feel?
And I feel good. I feel good, and the pain that I've been suffering for months is gone. I mean, I was a little bit sore, but that's from the surgery itself.
Yeah.
But otherwise, I feel good. Feel good.
Now, you've had back pain too, on and off for 30 years. We were talking about that. Tell us about those episodes of back pain. What do they do to you?
The first one that I recall was pulling out a sofa bed thing. And I got so far with it, we had company and I was opening up the bed, and all of a sudden I just could not move. I couldn't move. My husband had to practically carry me. So I was out of work for a week or so, and then at the chiropractor, and then gradually it got better, and I thought, well, that's fine. And I moved on. And then, had a couple other times like that. One time I was drying my hair, getting ready for work, with the blow dryer going like this with my hair, and all of a sudden, it's like I couldn't move. I couldn't move my arm down. I couldn't, it was that quick.
Yeah.
And I was out again for another week, laying in the bed and doing all that stuff. And then I thought I was fine, but not always, but for many years now, probably at least those 30, I had lower back pain, where in the morning I couldn't bend over to brush my teeth. That would really hurt.
Yes.
So I had that.
Do you have that pain now?
No, I don't think so.
It's gone.
The pain this morning, I was the first time in a long time I've gotten up first thing in the morning and was able to walk and not have that awful pain, because first thing in the mornings was the toughest.
I'm so happy for you. So how is this surgery going to help you in your life?
Well, hopefully once I can at least walk again. I was not able to barely walked with a walker. I was very active in my church and my
So you
community.
want to get active again?
And being in such pain now since July, and this is the new year, I'm anxious to get back to, my life.
Yes, of course. Well, you had 3 herniated discs in your lower back, and you can see in the footage where we went into each of those 3 discs, and I used a laser to clean the tear where you had a tear in the back of each of those discs called an annular tear, and the jelly from the center was stuck in the tear, holding it open, allowing more herniations to come out. So I got rid of the jelly that was in there using the laser, cleaned out the tear, and now your body will be able to heal that for the first time in 30 years. So I don't expect you to ever have that pain ever again.
Thank you.
You're welcome.
I am so thankful.
Well, you had faith and
am.
you found us.
Yes, I did.
You did what's right for your body, and I'm excited for you. So
I believe I did. I just kind of was led to you, and it just all went bing, bang, boom, and I didn't ask a whole lot of other people what they thought. I just did what I thought I needed to do.
Good.
For me.
Is there anything you want to say to your fans out there?
I would recommend that if you do something to your back, that you take care of it early on. You take care of it right away. The longer you wait, the harder it is and the longer it takes.
It takes a toll on your life.
Oh, definitely. It has taken a toll on mine since this summer, for sure, where I have not been able to, sometimes not function at all, barely be able to sit in a chair and be comfortable without squirming because I couldn't find that exact place where I didn't have pain.
I don't see you squirming anymore.
No, I'm not squirming. I know. That's great. Sit here without pain.
Congratulations.
Thanks to you.
All right, have a blessed day.
Thank you. You do as well.
All right, hopefully you're enjoying our broadcast from Deuk Spine Institute. I'm Dr. Ara Deuk-Majan, the CEO and founder of the Deuk Spine Institute. Welcome to our broadcast live stream. Our patient travels to us here in sunny Florida from an even nicer place, in my opinion, from a environmental standpoint, Hawaii. And the reason why somebody would travel from Hawaii to Florida, quite simply put, is to get out of pain. The pain that this patient has is back pain. And he's had back pain for years. It's only gotten worse, like most people's. And he was aware of all the treatment available out there: shots, medications, pills, THC, therapy, massage, chiropractor, and surgery. And he was also familiar with the different types of surgery, whether it's fusions or laminectomies or discectomies. As a matter of fact, he even had a discectomy. But in the end, he realized that the very best surgery for his back, for his herniated discs, and his facet joint problems was the Deuk laser disc repair and the Deuk plasma rhizotomy. These are 2 new technologies that were developed here at Deuk Spine for curing back pain that comes from a disc problem or a facet joint problem. So what's the difference? Well, basically, let's take a spine model, which is a model of the spine. And you can see there are bones that are stacked on top of each other called vertebrae. Between these bones is a large disc cushion. And then in the back you have a second type of joint, which is called the facet joints. You have a left facet joint and a right facet joint. So every motion segment, which is your vertebrae, includes 2 types of joints, the disc and the facet joint. And there are 2 facet joints, there's 1 disc. Okay? And what happens is people get disc injuries and facet joint injuries when they have trauma to their spine. So there's a sudden movement that rips the fibers of the disc or the facet and destabilizes the joint. And over time, with the disc, you get a herniation. With the facets, you get tears in the capsule that get inflamed and painful. So we treated his pain, which happens to be coming from both the facets and the discs. And we did the disc treatment with the Deuk laser disc repair. We did the facet treatment with the Deuk plasma rhizotomy. And just to give you an idea of the difference between the Deuk plasma rhizotomy and a radiofrequency ablation, you can see with an RFA, a needle is placed right there where the red dot is, and then the doctor leaves it there and burns that spot. You only get about a millimeter burn around the needle tip, and same thing here. But with the Deuk plasma rhizotomy, we have a special device that comes in and it localizes and really burns the whole area. So we make sure we get that pain nerve. It's a much better procedure. The Deuk plasma rhizotomy, it is going to be patented, and it's going to be become very popular because it works better. The problem with RFAs is that people just keep coming back every 3 to 6 months for another one, and then it wears off. The thing about the Deuk plasma rhizotomy, it's a one-time done and cured, and you don't keep coming back. That's what Deuk Spine Institute is all about. High-quality solutions to chronic back and neck pain that are cures, where patients don't have to keep coming back and getting the same procedure done over and over again. All right, we'll take our questions.
First one comes from SPX730 on YouTube.
Hello, SPX730.
And they ask, how do you know it's actually facet joint pain going by the patient's feedback?
It's not just the patient's feedback that I use. I use something called the physical exam. I use probabilities. Probabilities are very important. If you understand what probabilities are, probabilities are basically the ability to predict the occurrence of something happening. For example, what's the probability of the sun rising tomorrow? It's almost 100%. Maybe it's like 99.999 to infinity percent, right? There's a small chance the sun won't come up tomorrow, but it's almost zero. So probabilities tell you the chance of something happening, okay? What's the probability of flipping a coin and getting heads versus tails? It's 50-50. So when it comes to understanding the sources of back and neck pain, you must understand the probability of those sources occurring. And that's what Deuk Spine Institute has. We have that data from treating 100,000 patients over the last 20 years. We have that data. We know exactly where the pain comes from and the probabilities of that pain. So for example, we know that the L4-5 disc is the #1 cause of back pain. The L4-5 disc annular tear, we know that because we've treated 100,000 patients, and we look at the incidence, which is the occurrence of L4-5 being the source of back pain. And we know that because we treat L4-5, and guess what? The pain goes away. So you know the L4-5 was a source. So we're able to confirm our diagnosis through treatment, and that's very important. Other doctors cannot do that. They cannot specifically treat the L4-5 disc and specifically treat the tear. The Deuk Spine Institute can. No other doctor can, okay, unless they copy our techniques, which we're broadcasting every day anyway, so why not? So that answers the question. It's really based on probabilities, and it's also based on location of the patient's pain. And then it's based on physical exam, like touching and palpating that area. Very important. Doctors these days, they don't do physical exams anymore. They should. It's a lost art, and it's very important in making the right diagnosis for back pain and neck pain. If you don't do a physical exam properly, you will not get the right diagnosis. You cannot use an MRI scan. MRI scan will not tell you where pain comes from. You show me the first MRI scan in the world, and there is none I'm aware of, that will tell you the pain is coming from this disc. Just show me one impression, one report, one finding, one, at the end of the MRI report where the radiologist talks about the summary, okay, of important findings. Show me one that says the back pain is coming from this disc, the back pain is coming from this facet. You'll never find it because radiologists have no clue what causes pain. They don't. They're just reporting on structural abnormalities. And everybody has structural abnormalities in their spine, but not everybody has pain. So which structural abnormalities cause pain? That's what Deuk Spine does. We figure that out.
All right. And next question comes from Canes25 on YouTube. And they ask, Doc, is that a new x-ray machine? Those images are crazy crisp.
Hey, thanks for noticing. Yeah, that's not one of our new machines yet, but I like the fact you're keeping on top of what's happening here. So I just talked to Monica. Monica is in charge of all of our diagnostic imaging here at Deuk Spine. And we just purchased 2 top-of-the-line, brand new Siemens flat panel x-ray machines. And they're not just x-ray machines. These are special because they're called C-arms. Because literally, and we'll show you maybe in the next surgery what a C-arm looks like, but it literally has an arm that goes like this. And on one side, this side, it releases x-rays, and on this side it detects them. And the x-rays pass through the patient, right? So you can actually see the spine. A true x-ray machine doesn't let you do that. X-ray machines run about 40 grand. These special C-arms that we use are $160,000 each. So we just bought 2 of them. We're spending over $300,000, and they are arriving tomorrow. But just because they arrive tomorrow doesn't mean we'll be using them tomorrow. They have to be installed. And the installation process means that an engineer has to come from Germany. He's got to, install the software properly, make sure that, machines are configured, they're running properly, because something could happen in transportation. You could knock something loose. So they've got to, of course, install them and make sure they're working properly before we use them on a patient. And that's going to happen next week. So you will see the new ones in operation next week. The reason why, hey Richard, the reason why this patient had such beautiful pictures is because honestly he's a thin guy and doesn't have a lot of like me, he doesn't have a lot of fat. I have a lot of fat. And so when you have more soft tissues, it's a nice term, politically correct. When you have a lot of soft tissues, the x-rays don't penetrate the soft tissues as much, so you get less x-ray penetration, so the bony anatomy is not as crystal clear. But with this guy, he's got a perfect physique, and he's got great bone. Oh yeah, the bones have to be good too. Like you can't have osteoporosis, osteopenia, you can't have demineralized bones, otherwise the x-rays don't bounce off them as well. They kind of pass through the bones, and you get a kind of like not such a good picture with the bones. So if the patient has really strong bones and they got a great physique, you're going to get good x-ray pictures. We don't buy the $160,000 fluoro machines for the people with easy to see bones. We buy it for the people that have the extra padding like me. That's when it really counts. That's where your money really gets used best. It's for those patients where you can see things that other machines don't let you see, like the GE machines. They're crappy in my opinion. Those machines don't let you see the details as well. And then you're kind of guessing, well, where is my needle tip? I can't really see it. Can you see it? Nope. Oh shit, well, we should just treat right there before we go any further, because we don't want to cause any damage to the patient, like damage a nerve. So let's just treat the fat, basically. And that's what ends up happening. And that's why people don't get better with shots. A lot of times they don't get better because the doctor wasn't in the right place. The doctor wasn't in the right place because they have a cheap piece of shit fluoro machine that they got, for 40 grand or 50 grand off the eBay. We don't believe people, we believe every single human being, every single person here at Deuk Spine should get the best treatment in the world. And that's why we buy the best equipment, we have the best supplies, we have the best medications, we have the best techniques, and we have the best doctors. Because we believe quality results in a better product. I mean, think about it. If you're gonna make a wedding cake, do you want a buttercream wedding cake from Publix, or do you want a nice royal fondant wedding cake with that nice cake batter and nice design? You want the best. Why? Because it's your wedding. It's important. We think about every spine surgery as being the wedding, for every person. We want them to have the best result.
All right. Next question comes from Lori on YouTube. And they asked, what is the cause of annular tears and why does it tear?
So Lori's saying, what is the cause of annular tears? Trauma, okay? So what happens is you've got this nice little disc between the bones. The bones are super hard, super powerful. You've got a cushion, a jelly cushion between them. If you rock your bones suddenly, apply force, like fall off a roof and suddenly smash, it's your disc that's going to take the force. It's going to rip, so the disc is going to rip. That's the problem. And there's actually studies that have been done in orthopedics. Don't go anywhere. We're almost done. Where the velocity of the injury to the body part, like a joint, the velocity of the injury determines if it's the soft tissues that take the force or the bones that take the force. And in this case, it would be the soft tissue, the disc, that takes the force. You never see fractures. I mean, we never see fractures. Fractures are rare. People do get fractures, but they have to be in a high-speed motor vehicle accident. They have to fly off a motorcycle and fly 50 feet in the air, and then they're going to have fractures, right? Or car crashes, really high-velocity car crashes. But all the low-impact injuries, they injure not the bones. They don't cause bones to fracture, the soft tissues the fracture. That's really what it is. It's a fracture of the annulus. So the annular tear is a fractured annulus. But if it's the bone that's going to fracture or the annulus is going to give first. The bones are hard and strong. So the annulus is going to lose every time. Anyway, that's what causes the annular tear or annular fracture. It's truly a fracture of the annulus. And then, of course, the jelly pushes through the tear to make the herniation. By the way, our new website's going to be launched probably in about 2 months. And it is unbelievable. Unbelievable. We have invested a lot of time, about 6 months building it. And my God, when you see it, it's a work of art, I have to say. We have these animations that are incredible. I never dreamed I could have such good animations. I always thought stuff like that was way out of my price range because, you know, we're a small company. Literally, we're located in a 20,000 square foot building here in Space Coast of Florida in 2023 and since we started. And basically, I've always looked into medical animations to teach people, but they were like ridiculously expensive, $40,000, $50,000 for an animation. I just didn't have that kind of money. So we now found a company in Europe that's doing them, you know, graphics illustrator. It's incredible, the pictures, the animations. So the point I'm trying to make is you're going to see the actual normal anatomy of the disc and the spine. You're going to see what happens with an annular tear, with an interposed herniation, a disc bulge versus protruding disc. You're going to see how all these things play out. And we're even going to do the animations for things we don't do and don't recommend, like laminectomy, fusion, microdiscectomy, discectomy. We're going to show you the problems with those procedures, why you should never have them done, because they're ruining your spine permanently for the rest of your life. It's like when you have a laminectomy and discectomy, it's like having herpes. It never goes away, and it just keeps coming back to haunt you and bother you. And, you know, fusion becomes the only option, okay? But maybe even herpes isn't as bad as having a laminectomy. Sorry, I hope I'm not offending anybody, but I'm trying to drive home a point. And I just am so repulsed by the whole idea of taking bones and ligaments out of people's spines to get to a herniated disc and then not even doing the job right, so people still have pain and they end up needing fusions done. But that's exactly what happens with most spine surgeons. There's so much waste going on in America and the rest of the world with pain management procedures, spinal cord stimulators, pumps, epidurals, facet, rhizotomy, RFA, sacroiliac joint fusions, interspinous devices, mild procedure, all of it garbage. None of it works properly. Patients always have problems, and they end up either suffering in pain for 20, 30, 40 years, spending hundreds of thousands of dollars in pills and treatments that don't work, or they end up killing themselves. And it's sad, because I don't want to see any of that happen. I want everybody to get better and be out of pain, and it's possible to do that now, but you have to do what we do at Deuk Spine. Unfortunately, other doctors don't know how to do it.
And we have a few more questions. The next one comes from Martha on YouTube asking, hello everyone, new to the channel. My facets have...
Hi, Martha.
My facets have arthritis in the center of my back and a herniated disc in the L4-S1. What is the best treatment? Thank you.
Hi, Martha. Thanks for asking a question. And the question Martha's saying is, I have a herniated disc at L4-S1 and I have facet pain in the middle of my back. The best treatment is what you just watched. So just hit rewind, go back and watch it again. The best treatment for a disc problem, like a herniated disc, is the Deuk laser disc repair. We just did it. We repaired this man's disc. The best treatment for the facets is the Deuk plasma rhizotomy. That's where we go in and burn the pain nerve at each of these locations to deaden the facet joints. There are no other treatments that work. Other treatments will work temporarily, like an RFA, may give you a few weeks or a few months of relief, but then the nerve always grows back and you get the pain again. They'll tell you that if you ask the doctor. Ask your doctor, if I get an RFA, is that permanent? Every single one of them, if they're being honest with you, which they should be, will tell you you're going to have to keep coming back for more treatments. The only thing besides the Deuk plasma rhizotomy that will actually cure your facet pain, cure it, with one treatment, and the disc pain is a fusion. Done. Because fusions stop the movement. They stop the pain from the disc because you take the disc out and put a cage in, so the disc is gone, and they stop the movement at the facet joint, so they treat facet pain. But do you really want this on your back? I mean, they're becoming more popular, right? Like when I graduated from Shands Hospital neurosurgery training, I was doing fusions all the time. They were new. They were the new 360 fusions, they were new, and they worked really well. And I did that for every one of my patients. And I've even published papers on it. You can see it in PubMed. Okay, just go look up the National Library of Medicine. So these fusions work great for getting rid of disc pain and facet pain, but then they cause problems. They cause scar tissue, muscle damage, dead muscle, chronic lumbosacral strain, deformity, loose screws, infections, nerve damage, spinal fluid leaks, scar tissue, adjacent segment disease. The list goes on. None of those problems happen with the Deuk laser disc repair. Zero. We never have a single one of them happen. You don't get scar tissue because we're not cutting your muscle. We're spreading the fibers with the dilator. You don't get adjacent segment disease because we're not putting any metal in your spine. It's natural movement being restored. So the list, list goes on. We don't even use narcotic painkillers on our surgeries anymore. All the patients that have Deuk laser disc repair, they take Tylenol and a muscle relaxer. That's it. There's no painkillers given. There's no need for narcotics or opioids, which are dangerous. So you've just watched the best surgery for your problem. What you need to do is you get a free MRI review, and to get that you type in mri.deukspine.com. Is that what it is?
Yep. You're right.
Anyway, we'll put the link on for you. You click on the link, you go to our website, you fill out the form, you send us your MRI, either upload the images on the website or you send us the MRI on a CD, and we'll once we get it, we can schedule a review. You'll get 10 minutes with me. I'll figure out what's wrong, what needs to be done. I'll give you my recommendations. I'll answer your questions. Any questions you have, I'll answer them. And then we're done. And then you can decide if you want to get it fixed or not. But that's what I would recommend as the next step. Next question.
Last but not least, we have from Daniel 1970M on YouTube.
Hello, Daniel 1970M.
And they ask, is this procedure too hard to reproduce by your average neurosurgeon? Honest opinion. You have honed your skills over the years and have stated a surgeon must have a strong knowledge in anatomy. Thank you for sharing these procedures. I have watched hundreds of your procedures. I love the explanations throughout each procedure. Blessings.
Thank you, Daniel. We really appreciate your sentiments and your support. You are correct. Most surgeons, spine surgeons, and there's two types of spine surgeons. Well, all right. Let me rephrase that. I have to be careful because nowadays we have a third type. We have legitimate spine surgeons like neurosurgeons. We have legitimate orthopedic surgeons that do a fellowship in spine for a year. They've trained in how to do spine surgery. They're legitimate spine surgeons. Neurosurgeons are legitimate spine surgeons. At least 90% of them are. And then you have the illegitimate spine surgeons, the people who want to be spine surgeons. Okay? For example, I'm sorry, but it's the truth. I always tell you the truth. You may not want to hear it. The Bonati Spine Institute just closed. Literally was closed last week. The Bonati Spine Institute is on the other state of Florida. Here we are, where NASA is. If you go across to Orlando and keep going to Tampa, that's where Bonati Spine is. Bonati Spine hates us because we do good surgery, we have great outcomes. All right, but Dr. Bonati is a pioneer. I have respect for the man. At least I had respect for the younger man when he was a good surgeon and he was pioneering and doing good things for patients. He was making smaller incisions. He used the endoscope, but he used a tubular retractor that was big, and then he would drill holes in your spine, okay? So he did what everybody else did back then, but he did it with a smaller incision. Kudos to him. Bravo. I love the innovation. The problem is they stopped innovating like 30 years ago. And, you know, I'm not trying to bash on them, but they were literally closed down by ACA, which is the Agency for Healthcare Administration. They run all the hospitals and surgery centers and nursing homes in Florida. It's the government. And they found that the Bonati had a surgical scrub tech, the person who hands the surgeon the instruments, he was actually operating. I mean, doing the full surgeries himself. Okay? Then you've got also chiropractors down in Miami. They're doing surgery on people. They shouldn't be. Okay, they're not surgeons. Now, the biggest problem isn't chiropractors doing procedures, which is a problem, by the way. It shouldn't happen. But the biggest problem is pain management doctors doing spine surgery, anesthesiologists doing spine surgery. These are actually licensed doctors with a license. And the problem in medicine is that when you get a license to practice medicine, they're all the same. Okay? My medical license is no different than an anesthesiologist, no different than a primary care doctor, than a pediatrician. We all have a license. Okay? So your license doesn't say neurosurgeon, all right? And what happens is, because the medical board recognizes everyone equally as a doctor, and the ability to do surgery comes from what's called privileges, where a hospital or surgery center gives you privileges to do surgery, okay? And they're supposed to have a committee that follows strict guidelines and only gives the right doctors the ability to do surgery. Well, what's happening all over the country, and this is a big problem because people are suffering and money is being wasted by the billions. I want to fix that. I can fix that. I have a way to fix it. The problem is that these surgery centers are popping up everywhere. They're paid for by venture capitalists and companies that are supported by VC, and they're just hunting for profits. And so what they do is they open a surgery center, and they're getting the pain management doctors to do surgeries. Okay, and they're giving them privileges to do surgeries. So you got far more pain management doctors than you do spine surgeons, legitimate spine surgeons. So these are the illegitimate spine surgeons, and they're everywhere. And they're doing surgeries on the spine now, and nobody's stopping them. People need to be aware of this. This is a huge problem, and they're hurting patients, and they're squandering millions, billions of healthcare dollars, truly, and there's no stopping the site, and it's only ramping up and getting worse. People need to be aware of this. So, who's capable of doing what I do? Honestly, I could teach a monkey to do what I do properly, okay? But it has to be a pretty smart monkey with good hands and a really good conscious monkey. But that said, you're right. A lot of doctors in general, they're just, honestly, I hate to say this, but they're shitty people, okay? And what I've learned running this company for 20 years is that good people make good workers. So if you have a good person who's a doctor and a neurosurgeon or orthopedic surgeon, they can learn this technique, okay? They can learn this technique. But the problem is, who's going to teach them? I'm the only guy teaching, or gal. I don't mean to be sexist. And the equipment you have to buy, okay? It's literally, to set something up today, you need $15 to $20 million. Where are you going to get that money? Nobody's going to give you that money. So you can invest that kind of money, and then you got to sit around and wait for the cases to come. You might make $200,000 your first year, okay? But you got $20 million in debt. And the debt service on $20 million, 10%, you're looking at $2 million a year in interest payments. How are you going to pay $2 million a year when you're making $200,000 a year doing these procedures your first year? It doesn't add up. That's the problem. There's no money, there's no equipment available, it's very expensive, and there's nobody to train. And to be quite honest with you, I make $1,000 for this surgery. That's my pay. I could do a fusion, and I can make $10,000 to $15,000. That's the problem. These surgeons are putting in screws and rods because they pay so well. I hate to say this, but when artificial disc came out and they were paying $1,500, you could do a fusion for $15,000. Why do you think artificial discs never got popular? They never got popular because the surgeons make 10 times as much doing fusions. It's sad, but it's true. I'm not an advocate for artificial discs. I wouldn't put an artificial disc in a patient. I think it's a horrible idea. I would do the laser surgery. That's the best. Great question, and thank you.
That is it.
All right, we've got another surgery coming up. This patient next is the Deuk plasma rhizotomy. She's got Quite interesting. She has a fusion done by somebody else, not me. And of course, she's developed what's called adjacent segment disease. Yes. Thanks. So, see the fusion? These bones don't move. They're stuck together now. There's no movement there. All the movement has to happen above and below. That's why you get adjacent segment disease. So that joint right there, that facet joint right above her fusion, you all see that? That's where her pain's coming from on both sides. So we're going to go in there. You're going to find the fusion with the x-ray, and we're going to target the pain nerve called the medial branch of the dorsal ramus. You can actually see it right there, and it travels down and innervates the facet joint. We're going to try to burn that nerve with the Deuk plasma rhizotomy. All right, that's going to be the next surgery. It'll be a quickie, and then I think we have one more after that.
Yeah, DPR.
Another DPR?
Just 2 more.
So 2 more DPRs today. Boy, they're gaining in popularity. Have a wonderful day. Thank you for all the questions and the audience and the participation. And like somebody said earlier, I'm not going to pay money to promote my videos. I will never do that, okay? I just don't have the money. I'd rather put the money towards patient care. I'd rather put the money towards buying a fluoro, buying a new laser. I don't want to spend the money on Facebook, Google, YouTube, Twitter, Snapchat, whatever. Okay, LinkedIn. I'm not going to pay these people money because I believe that's a waste of money, that money should go towards fixing people's backs and necks, okay? So I don't want to take that and spend money on marketing my videos. So if you think what we're doing is valuable to the world, then you need to spread it and do that for us, because we're not going to do it. All right? That's just my philosophy. I'm totally against spending money on things that I don't think bring value to the patient experience. And I'm a big patient advocate. I want everybody to know about this. It makes me angry, really angry, every day when I think about the fact that we're curing people's pain. There's people out there committing suicide because they can't get out of pain. There's people out there getting unnecessary, horrible, harmful procedures done to them because they don't know about our treatment. It makes me very angry, but I don't have the budget, I don't have the money to fund a advertising campaign. I put my money into patients that I'm treating. I guess that's really what it comes down to. So I want you guys all to spread the message. Spread the message that we can cure back and neck pain and Deuk spine, that people don't have to suffer anymore.